In this unit, I'd like to look at the parallels between the autonomic nervous system and acupuncture. It's not meant to be a complete analysis, but just to give you some feeling of how there is some evidence to suggest that the autonomic functions and centers within the body are affected by acupuncture. So let's take a look at the neural mechanisms underlying acupuncture's role in potentially regulating the cardiovascular system. So looking at management of hypertension, for example, it's known that the stimulation of acupuncture points near the median nerve on the inside of the wrist would lead to the release of GABA, and that these would inhibit normally induced visceral reflexes that would increase blood pressure. They inhibit the sympathoexcitatory reflexes that are normally mediated through glutamate, and this is coordinated within the sympathetic neurons in the medulla. Now, within these, the afferents, that are picking up the signal from the acupuncture, they're believed to feed into the arcuate nucleus of the ventral hypothalamus, and endogenous opiates like endorphin and enkephalin are produced, and this effect is blocked by the opiate antagonist naloxone. So it's a pretty clear connection, pharmacological connection, that this mechanism is in play. The overall picture is that this is altering a long loop pathway, and it's most effective when there's 10 to 30 minute, which is prolonged acupuncture stimulation of the somatic afferent by acupuncture. So here is a connection between an acupuncture point and management of blood pressure. Now let's look a little bit more carefully about how this might actually occur. The theory behind acupuncture involves neurovascular connections, and in the mindset of the acupuncturist, redistribution of blood is very important, and so you can imagine, that's going to affect the cardiovascular system. So these neurovascular alterations, the mechanism I just described, leads to blood redistribution. In addition, opiates lead to a lowering of the demand for oxygen. We know that by reducing reflex-induced increases in blood pressure I just described. The clinical applications of this, as are actually applied in acupuncture in traditional Chinese medicine, are hypertension, congestive heart failure, and myocardial ischemia. Not too much of a problem in animals, but the first two, congestive heart failure and hypertension, do occur, and therefore might be an evidence-based way of managing these conditions in veterinary patients. So in this figure, we have the traditional representation of the autonomic nervous system, and make the point that we have the sympathetic and the parasympathetic side of the autonomic arms, if you will, that in many ways, at least with respect to the cardiovascular system, have parallels to the concept of yin and yang and acupuncture and traditional Chinese medicine. So looking back at the previous mechanism that I just described, what is going on with managing blood pressure is the reduction of the sympathetic outflow, which we know is diffuse. You can see that the thoracolumbar output here of the sympathetic nervous system. In addition, its output through the adrenal medulla are meant to be rapid stimuli to activate many different tissues. And the one that we just focused on was on the smooth muscle of the blood vessels. And of course, stimulation of major blood vessels to contract will lead to increased blood pressure. So by acting at a central point to reduce the loop feedback, into this system, acupuncture potentially can reduce blood pressure. We also have the other aspects of the autonomic nervous system that will probably crop up as you talk about acupuncture that I don't have time to go into, but I think when you hear about effects on the cardiac system, some of those could be autonomic, effects on the endocrine system could be autonomic, and certainly the rest of the vascular system. So as a reminder, again, the autonomic nervous system basically determines the difference between the sympathetic diffuse activation and the parasympathetic nervous system, which is where the innervation goes directly to certain organs, smooth muscle, glands, etc. We call that selective activation, that sort of vegetative function. And all of these are overall affecting the function within the body. And I think is perhaps the easiest concept to think about with regards to Western medicine that relates to the connection between all these things in the nervous system and therefore to an acupuncture point or alteration of a feedback mechanism. So indeed, the autonomic nervous system is a balancing act between two forces, the basically sympathetic and parasympathetic. As we'll talk about what tone is basically where does a particular organ fall at that time or under normal resting conditions. And so our concept of yin-yang here is also about that there's a balance that needs to be found. And there's even the concept that many of these acupuncture points don't work unless there's some imbalance. And so that it's sort of the idea that there's no negative effect of trying an acupuncture, because if that's not where the problem lies, then it's not going to be an adverse effect. Acupuncture, and it has been shown in some cases to only work when there's been some pathology at that site. So that's kind of an interesting perspective from the standpoint of safety. In further reminder of the concepts of autonomic tone, basically you can have in most tissues the balanced antagonism, which is double innervation, both parasympathetic and sympathetic, and examples of this are in the respiratory bronchi, the heart, etc. Where that balancing is determined by activation in the sympathetic or parasympathetic system. There can also be complementary effects, which mean that in the vascular system, the peripheral skeletal muscle vasculature, you can have both sympathetic and parasympathetic working in the same direction, generally leading to vasodilation. And then there's examples like the eye, where there are two completely separate muscles, and one innervated the dilator muscle by the sympathetic nervous system, and the dilator radial muscle, and then the sphincter muscle is innervated by the parasympathetic nervous system that leads to your meiosis or mydriasis. And finally, I think it's really important, even, and this is a slide I use when I talk about autonomic nervous system drugs, and you can see that I've used this in the context of antagonists. It's very important to understand that there are normal functions associated with the autonomic system, and each tissue will be a balancing act between the sympathetic and the parasympathetic at any given time. The normal tone of the GI tract is generally parasympathetic, the heart parasympathetic, the bladder smooth muscle, parasympathetic, and the iris muscles, parasympathetic. That's why when you use atropine, put it in the eye, you get mydriasis because you're blocking that dominant tone. It's a very dramatic effect. Whereas for the vascular system, it's the effects of the sympathetic nervous system that are most prominent. The alpha-1 receptors being stimulated by epinephrine, norepinephrine release. And notice what we talked about with regards to managing blood pressure is the idea that if acupuncture can impede that or can alter that, then you have a hypotensive effect. And the other tissue, the bronchial, bronchial smooth muscle, the dominant tone is your sympathetic tone. And for this reason, the better bronchodilators, such as terbutaline, a beta-2 agonist, would be sympathetic in nature. So keep in mind autonomic tone when you think about all of the things that are being discussed with regards to acupuncture, particularly if you know that autonomic tone can be altered. So these affect many, many different tissues, and therein lies the connection between the neurophysiology, the neurovascular physiology, and the clinical effects.